Good day everyone. I'm Daniel, moderator for this webinar. I welcome everyone for today's webinar 2024 SAMHSA 42 CFR Part 2 Updates and Changes. I would now like to introduce our presenter for today, Brian L. Toto. Brian is a certified professional in health, IT, certified HIPAA professional, certified HIPAA administrator, certified business resilience auditor, certified information system security professional with over 18-year experience in health IT and compliance consulting. I would now like to hand over the floor to one of the best speaker. Over to you, Brian.
Thank you very much. So what is SAMHSA? SAMHSA is an acronym, just like HIPAA. Substance Abuse and Mental Health Services Administration. That is what SAMHSA stands for. Now we'll start with SAMHSA and we'll segue later into HIPAA. The Substance Abuse and Mental Health Services Administration, which is of course what SAMHSA is governed under HHS, Health and Human Services. SAMHSA came out in 1992. The concept with SAMHSA is to provide prevention, treatment, and recovery support services for behavioral health because this is an important part of the health service system for the entire country. So last year, 2023, and this is pretty shocking, over 20 million folks in need of substance abuse treatment didn't receive it. There are 4 pillars in which SAMHSA stands upon. Number 1, behavioral health is essential to health. Number 2, prevention works. Number 3, treatment is effective. Number 4, people do in fact recover from mental health and substance use disorders. That's the 4 pillars. Protected health information under Part 2, meaning substance abuse records. Patient record confidentiality, 42 CFR Part 2. That's where it's found in the Federal Register. These are federal regulations which specify restrictions concerning the disclosure and use of patient records pertaining to substance abuse treatment that federal programs maintain. Let's start. Does 42 CFR Part 2 apply to you guys? Number 1, you must be federally assisted, and you must provide substance use disorder treatment. Here's a little checklist to figure out, are you federally assisted? So let's look at a few examples, a few scenarios rather. Does Part 2 apply to my organization? Example 1, opioid treatment program. Okay, let's move to a mixed use facility. And we'll call it Acme Community Mental Health Center. All right, let's talk about an accountable care organization. Does Part 2 apply for this hypothetical accountable care organization? Last example, medical records, medical information is not created the same. We need to separate substance abuse records from normal medical records, higher risks, potentially legal consequences for not properly securing these types of records. Okay, so let's ping pong these two off of each other for a little bit here. SAMHSA and HIPAA. HIPAA, similar to SAMHSA, is also a gigantic regulation. HIPAA says that a patient's medical record, or PHI, protected health information, may also be referred to as ePHI, electronic protected health information, may not be released by the healthcare provider except under the following circumstances. Part 2 regulations have adopted, of course, HIPAA, a little bit like HIPAA on steroids, I like to say. SAMHSA is Part 2. Disclosures without consent. While the HIPAA regulations permit the release of patient information without consent for purposes of treatment or payment, SAMHSA is much more restrictive, as we know. There are only limited exceptions, like for medical emergencies or for provider audits or government audits and evaluations, when information can be disclosed without consent. A qualified service organization is a provider or organization that provides services to a Part 2 program. Okay, let's talk about some of the notice of proposed rulemaking. Permit the redisclosure of Part 2 records as permitted by the HIPAA privacy rule. Also proposes to create 2 patient rights under Part 2. Also proposes to prohibit Part 2 programs from requiring patients to waive the right to file a complaint. It modifies a notice of privacy practices requirements for covered entities who receive or maintain Part 2 records. Now, while this goes into effect 2026. Let's talk a little bit about health information exchanges and part 2. I get a lot of questions about this. HIE, I mean Health Information Exchange. And that's a generic term to refer to a number of methods and mechanisms through which information can be exchanged electronically. A patient has all the power here. Of course, they can revoke consent to one or more named parties in a multi-party consent form while leaving the rest in effect. You got to have policies and procedures on this, and you must train staff on your policies and procedures. What are some changes, other part 2 changes that we need to look at that required February 16th beyond what we just looked at, changes relating to the notice of privacy practices? So part 2 regulations, as we know, serve to protect patient records created by federally assisted programs for the treatment of substance use disorders. Applicability and redisclosure. Treatment records created by a non-Part 2 provider based on their own patient encounters are explicitly not covered by Part 2, disposition of records. When a substance use disorder patient sends an incidental message to the personal device of an employee of a Part 2 program, like a text, the employee will be able to fulfill the Part 2 requirements by simply deleting the message. Consent requirements. Disclosures permitted with written consent. Disclosures to central registries and PDMPs. Medical emergencies. Audit and evaluation. Undercover agents and informants. And some of the other changes, patients may consent to allowing disclosures of their information to providers through a health information exchange. How can one get access to patients' information? Well, to access patients' medical records, you need to be a participating member of a health information exchange. Politics and enforcement of these regulations. We just got a new director at OCR. Cyber threats. It's impossible to talk about HIPAA, even part 2, without including cyber threats. Now, we all know about the geopolitical stuff. I'm not going to get into all of that. Yes, there's that whole mess going on. We're going to, number one, you're going to have good technologies. This is an oldie but a goodie, been around forever, but the modern email spoofs are AI generated, artificial intelligence generated. Ransomware. Now, ransomware is the number one way, as I said, data is breached in the world. Generally, you get ransomware, or they are also called cryptovirology attacks. You get them through a phishing type email, the fake emails. OCR made this official in 2019. A ransomware attack, if it attaches to unencrypted PHI, is a HIPAA breach. A little bit HHS put out about mobile devices relating to part 2. So there's just guidance out here about what we need to do. Your phone tracks everywhere you go. Trial attorney's very dangerous aspect because of the type of information that we deal with. Now again, no profit sharing. It has to be of a highly sensitive nature. All right, few resources and we'll wrap this up. Let's start with some HIPAA resources. HHS.gov is the governing body. If you're audited for HIPAA, this is the protocol in which the government goes by. Healthit.gov, that's a fantastic resource. SAMHSA resources, pretty simple, SAMHSA.gov. Okay, in the end, be proactive. I think I covered everything there I wanted to hit on. I hope you guys got some good information out of that and enjoyed it for as much as you can enjoy a speech on federal regulations.
Thank you, Brian. That does conclude the session for today. Thank you everyone for participating. You may all disconnect now. Have a great day ahead.
Thank you.